come up here a little closer. Anyone?
Packet for Diane.
One cup?
Loretta.
Oh. Is he gonna do it? Yeah. So I'm gonna start ahead and work backwards. Okay? So the first thing you want to look at is your horse's gum color. It should be, okay, you want to look at your, you can come a little closer, right? You should look at your horse's gum color, especially if they're showing signs of colic. Okay, they should be like a light pink. What we don't want to see is we don't want to see brick red or really dark, like purple. Okay, so if you could just lift up your horse's upper lip and look just above his teeth, see he's a nice pale pink color. I know you guys can't see it, but you can always check. And then the other thing you want to do if your horse is colicky is you want to check what we call the capillary refill time. Okay, which just means how, if I blanch out his gums, how fast they turn pink again. It should be less than 2 seconds. So easy, just lift their upper lip, press your thumb against their gums, and count how long it turns pink again. Okay. So if it's a longer period of time, call you red. Okay. That's not a good sign.
Can't hear you back here.
Okay. So when you press on the gums and blanch it out to white, take your thumb off, it should be less than 2 seconds to turn pink again. If it's more than that, you need to call you red. That's not a good sign. The other thing too is if you see, they should be just a nice even pink color. If you see a lot of like purpley blood vessels running through it, that's congested. That's another bad sign. Okay? And the other thing you can check in their mouth is the moisture. Is it good moisture there? Okay, it shouldn't be dry. Shouldn't have saliva just pouring out. And when it gets on your fingers, if it feels really tacky, even though there's saliva there, that means it's getting towards dry. He's getting a little dehydrated. Okay. The other way we can check for dehydration, I'm sure you've all heard pinch it with the skin on the neck. That's actually not the best way to do it. The skin on the neck will respond well even when they're getting partly dehydrated. So the better way to do it is if we check the skin on their eyelid. So just on their upper eyelid, just pinch the skin together perpendicular to their eyelid. It's more sensitive for dehydration. So it should bounce back right away. If you pinch it up, that fold. Hard. Because the horse won't allow you to. Oh.
Am I doing it right? Over the eye?
Hey, Barbara.
Yeah, all right.
Auditors, while this is going on, if you all want to put your hands on a horse, part of the deal was the sample horses were going to be touched by other people. So, especially when we come to the listening part and, feeling the pulse and all that, go and pick out a horse that's one of your friends or make a new friend.
So the response with the eyelids,
You can feel the heartbeat. Take it. That's a little bit difficult. If you don't feel it right away or if you have trouble finding that today, don't be surprised. That takes a while to learn to feel. Okay.
Is it on both sides, Carla?
Yeah, it's on both sides.
Can you show that again?
Yes. Right here. Underneath, down inside the jawbone. It can be difficult to feel, so that's going to take some practice, okay? You may or may not even find it today.
Carla, can you use any of your fingers?
Yes.
Okay.
Yeah, use any of your fingers. We're just feeling for heart rate. How much should the heart rate be? That's a good question. I should tell you that. Sorry. It should be 25 to 50 is considered normal.
Per minute?
Per minute. Yep. I have the lowest heart rate I ever found. I had a standardbred racehorse that was racing. They're fit as fit could be. 16, and the heart rate is 16. Wow. I know. And it makes it hard when you're listening with your stethoscope because it's bump, bump. Oh, you have to bump, bump. I'm alive. Yeah, exactly. Okay.
What if we can't feel it there?
You can't feel it there, you can use your stethoscope.
Okay.
But like I say, that takes some time to learn to feel it there. It's a little bit difficult.
Okay.
So you may not even find it today, but if you're persistent with trying, you'll get
Didn't know you were there. Go ahead, Dad. You said something.
Oh, I would have said something if you got close to the camera. No, you're fine.
An easy way, this is an easy way to see if you don't have a thermometer, you think your horse has a fever, you can feel their ears. It's kind of, it's not as accurate, of course. Remember, did your mom ever do that? Yeah.
Mitchell.
He's done standing. So you can
It's
just,
short attention.
just take your hand and just cup it around the back of the ear. And just see. Normal would be if I put my pinky towards the skull. Okay, so I'm grasping his ear like this. My pinky and my ring finger should be warm, and my other two fingers should be cool. So if they all four feel hot, that's too much. I say that's a more crude measure, but it's one way to go.
Could you repeat that thing about the ear again, please? I
Yeah.
missed that.
Just cup your hand around the back. That's just like that exactly. Two fingers, about 2 fingers closest to his head should be warm, and the other 2 fingers should be cool.
Oh, okay.
If they're all four hot, that's cool.
Oh,
Okay. So,
Another way, Carla, I've always felt their chests. And if they're real
yeah,
warm.
you can, but they're gonna be warm a lot of times too otherwise. Like I say, when we're doing it with our hands, it's not gonna be as accurate.
Right.
The other way too is a lot of times on my patients, I always I examine the mouth, and you put your hands in your mouth and it's hot. Ooh. And that tells you they've got fever. Okay. Okay, so let's go on. Normal temperature for a horse is 100.5.
100.5.
Yeah, they're warm, 100.5. It's not uncommon to find a horse to even be like 99, and that's normal for that horse. And the other thing is the horse's temperature varies throughout the day. They'll be about a degree higher in the afternoon and early evening than they are in the morning.
So basically, you should find what your horse's normal is, so you know the range.
Exactly. If your horse is always like 99 and he's 101, that's 2 degrees.
Okay.
But I would say on the textbook is 100.5, so up half a degree, that's not so bad.
But once you're starting to dip a couple of degrees is when
That's when
it's
I'm
getting concerned.
Yeah. Start to be concerned about it.
Carla,
So, yeah.
are you gonna say something about how to actually use the thermometer?
Yeah, I was gonna go from head to tail,
I'm sorry.
but we just kind of skipped a little bit.
Quit being the teacher,
Thermometer's
Loretta.
going in the tail side.
There was a question about the normal.
You're
meaning,
tired,
so I skipped a little bit.
Hey, Chris, can you turn around so I can see her?
Let's continue head to tail. So the next thing would be taking their heart rate with your stethoscope. Okay. If your stethoscope hurts your ears today, don't be surprised. They all do. Okay. It takes a while to get used to wearing them. So, and now to take a horse's heart rate with the stethoscope, we go on the left side, must be the left side, just behind their elbow. And that's because there's a little window in their lungs right there. The lobes of the lungs don't cover that, so we've got skin, ribs, and heart.
Turn him a bit.
Whereas if we take it in another spot, you're trying to listen through the lungs, and it's much harder. So, right here. And they're not as loud as you would think. Okay? So, you don't hear it at first. Just keep moving your stethoscope around slightly and be patient. Because remember, their heart beats 25 beats per minute. It's one every 2 seconds, right? Okay, so be patient. And the other thing you're going to find is that when the horse's GI tract moves, it covers up the heart sounds, just because it's much louder than the heart sounds. Okay. Normal heart, how does it sound? We all know, right? Lub-dub. Right, you've heard that, lub-dub, lub-dub. Horses, a lot of times you'll hear lub-dub, dub, lub-dub. That's what we call second-degree heart block, and that can actually be normal in horses. So when you hear that, don't immediately panic. Say, okay. Look at the horse. How does he look? He looks fine? Okay. So you can hear the heart on the right side, but it's much more difficult. And so for us, we don't have. We'll do that with veterinary medicine if we want to listen to specifically to the valves on the other side. That's, you guys probably don't do that. Cardiologists do that. Okay, and then the lung field in the horse comes here. It's all lung. Okay, it's huge.
Wow.
I'll show you guys in a second. Here. Okay. So that's where we want to listen to their lungs. So what we do is you want to put your stethoscope here and here and here and here and here and here. So you're listening several places in their lungs. What's the normal respiration rate for a horse? Should be 12 to 20.
12 to 20?
12 to 20. Yeah. So in the lung sounds, it should just sound like air moving. Okay. Right? Darth Vader. Okay. If you hear, sometimes you'll listen to them and you'll hear squeaks. Just eek, eek, squeaks. That's not good. Then they've got something going on in their lungs. Okay. Or if it sounds like air bubbling through water, sounds real moist, that's not good. You'll hear that in a lot of feeding horses will have both squeaks and thrills.
How accurate is it to just wash their nostrils?
You can, yeah, you can sure do that. Do that. Then you don't get to the quality of life. So yeah, absolutely, you can take the respiration. Yeah,
Where is, I'm going slowly. Where do you go for the heart?
and the left side, just behind the elbow.
Okay, stop switching.
So like where your girth is, or just actually even a little ahead of your girth. And it can be hard to find. And this is another thing, when your vet comes to listen to your horse's heart, lungs, or GI tract, try not to talk at that time. Okay, it's one of those little things, but all those environmental sounds you pick up through the stethoscope too, so it makes it really hard to hear. Okay. So then the other thing we want to listen to is we want to listen to horse's gut sounds, right? If you think your horse is calicking, you've got your stethoscopes now, you can listen to his gut sounds. We listen to gut sounds in 4 quadrants. Their gut is full of gas, it does the same thing. So, to ping him, just put my stethoscope here and then just thump around.
See the numbers
And if
going?
you hear a ping, then we go and we see how far away can I hear it. So if I heard a ping here, I'd progress until I couldn't hear it anymore. So that way you can kind of delineate where the gas is, how bad it is. Okay. If they ping at all, I'm concerned. If they ping over a large area, you call your vet. Okay. Yeah.
I did, decided to give him a treat of some alfalfa, and I had that gas thing, it was right in here, and I didn't have a stethoscope, I put my ear there, and I could hear it, and I described it to the vet, it's like a big pipe with water dripping.
Yes,
Tank.
gas distension
Yeah,
with
and
fluid.
That's a perfect description, and I could actually see it kind of pulsating right there.
Wow.
So, don't worry about it.
Yeah, yeah, not if you get so much GI upset from it. Okay, any other questions on gut sounds?
Are they the same on both sides?
They should be the same on both sides. They should be what we say a 1+ on both sides. So it's just kind of moderate. If there's nothing, we say it's a 0, and if there's excessive, it gets 2 to 3+. It's just usually how we grade it. Okay, so temperature. Y'all guys all know, you just put your thermometer in your rectum. We've got nice digital ones today, those are great. Ideally, to always put a string on it. I know you laugh, and the digital ones, they have more of a wedge shape, so they're not as likely to disappear. But if you use one of the mercury thermometers, the glass mercury thermometers, they will suck those in. Okay, so put a string on them. Okay, normal temperature for horse, we said 145. The other thing that is really important for you guys to do is to be able to feel for a digital pulse. If you have a sore-footed horse, if he's got a hot nail, if he's starting to founder, you need to check for digital pulse. And there's 2 places to feel for that. One is right at the fetlock. Right, you think that's good. So towards the back, what would that be, 2/3 or so way around? And you feel for a pulse.
I want to see where she's putting her. Where exactly are you putting it?
Oh, that's one place. You can also feel it down in the calf. He thinks I want his foot, so he's just being good. You can also feel it down in the Pasteur too. Either place is fine.
I can never find it down there.
In the Pasteur?
Yes.
Try it in Fetlock then. It's the same. It'll be the same. He's like, I'm giving it to you, lady. Yeah. So, and now if you're feeling a digital pulse and you don't feel one, that's good. That's normal.
And what's the pulse rate should be?
The pulse rate should be 25 to 50, but I wouldn't take it in the foot because normally you shouldn't feel it. If you feel it, that means there's some inflammation in the foot. And that's all that means, is inflammation in the foot. It could be a stone bruise, it could be a hot nail. It could be ridden on hard ground and his feet are just slightly inflamed. It doesn't always mean laminitis, so you just have to look at everything else.
So if you feel a pulse rate down there, that's not good. Is that what you're saying?
Yes,
Okay.
Yeah.
So if you want to check their pulse rate
I would do it on the jaw
underneath, that's,
or with this,
okay,
yes,
okay.
yep.
So that, no wonder why I'm not feeling a pulse rate down there.
That's good. Hey!
Your horse is dead.
Pulse rate, it's like, okay, can't feel one. I must be incompetent.
Okay. That's pretty much it for vital signs. Anybody have any other questions or anything else they want to know right now? Okay, we can all, if you guys want to start trying those, so check the gum color, check their heart rate, listen to the heart, lungs, and gut, check for digital pulse. Okay. And I'll just go around and make sure everybody's okay, and if you have any questions, you guys would join me.
I'm sorry?
That's a hard one. Yeah, it takes some time.
Yeah, I think you should have gotten a package from Loretta. Loretta's in charge. Okay, should I ask her? Yeah. She's right over there? Yeah, in the blue by the far corner. How are you, Ellie?
Good, good.
You're gonna go?
I gotta find a horse to look at.
Okay.
Here's the vet, my horse is
That's what I said. No pulse.
Hold on. Hold on, I have to finish this.
On the left side, low on the left side, high on the right side, low on the left side. Okay. So you want to be kind of behind his ribs here, because if we go up here, we're in our lung here. Okay, so we listen in the flank area, and you should hear a moderate amount of gurgling and rumbling and carrying on, right? That's good. If you don't hear anything, that's trouble. Or if it's like really rolling, like, you know, you've had those times when you feel your gut really rolling, you're like, oh, okay? You don't want it to sound like that. And the other thing we could do when you're listening to the gut sounds, if you think you might have like a gas colic or something, you put your stethoscope on, and then you do what we call ping them. You just take your finger and you flick their abdomen around